problems with my left knee. When I was young, my right knee had an accident with that, which resulted in not being able to bend that right knee. It's been like that for the last 70 years now. I'm 80 years of age now. And I think it resulted in a lot of extra pressure going on my good left knee. This resulted over time in a lot of wear and tear, which resulted in a lot of pain eventually in the last 10 or 12 years. I did actually have an arthroscopy 10 years ago in 2004, and since then my knee has gradually deteriorated to the point where was unable to walk. Couldn't really walk very far at all, and even less and less distance over time. But I didn't have any solution to it other than a possible knee replacement. And somebody told me about this this process, cell regeneration. This was told to me by a friend of mine who plays golf, who was a friend of one of the patients in this clinic. And he had great success, so I tried it and come along here. This is my 7th and final treatment. At the end of the 5th treatment, I noticed that where previously I was trying to get upstairs and having to haul myself up from both sides with banisters, I noticed on one or two steps, without thinking, I just stepped up, and without any pain. Also noticed the opposite, going down slopes. They were very, very painful to endure because the weight goes down as you're dropping down the slope. It tends to increase the carry on your knees. This was causing a lot of pain, and very, very difficult. But I've noticed that the last time I walked on the slope like that, I was quite not totally comfortable, and this is just yesterday. Not totally comfortable, but reasonably so. And this is after just 5 or 6 treatments. And I'm pretty sure that by the end of the treatment, and also at the end of perhaps another few weeks, I may well be able to do all these things without any problem whatsoever.
How much water have you been drinking each day?
Not very much. I think I would drink perhaps a pint and a half of water.
Yeah, and you're going to try and keep that up.
A litre
yeah.
or a litre.
You're going to try and keep that up because it does help, as I explained to you.
Yes, I think that's essential. I didn't realise it was so important, actually.
So now, it's good to know. So when you finish the course, we tend to cover a few things. So now you have had this MBST treatment, would you recommend it to others?
I definitely would, yes. Knowing what I know now, and I'm kind of assuming that it goes forward from here, and I'm fairly confident that I will be recommending it to quite a few people I know who have problems with knees and backs and so on. So I'm pretty sure I will.
And so you, as you just said, you know of other people in pain, and it'd be good for our clinic if you introduce some people, because we want it known more and more in the UK to help people like yourself that it's not always an answer, and yet MBST can create an answer.
It's so much better than having to go through operations and so on, which there is no great guarantee of success. It seems to me that from the people I've seen here and from people I know of, that this is a good option and a very successful one, I think.
Do you mind if I ask for some advice, please? From your perspective, do you feel there's anything else we could do?